I'm Lisa with Adam Medical. You're going to be trialing our dual incubator here from Adam Medical. We are an 85-year-old Japanese company, by the way. That's all we do is infant warming, and our goal is the same as yours, to save the life of a tiny baby. So with that being said, we're always under 40 decibels of sound in our units. We have an air curtain that's on 100% of the time. So we do not have a boost motor per se. It's in the design of the airflow. So it's always going to maintain a quiet environment in here. So because of also that air curtain and the way the air is designed to flow here, you can go up to 90% humidity and still not have rain out in here. But just consider, if you do have a secondary oxygenated humidified air source coming into the unit, that once you get 100%, it will come out of the air. That's just physics, but you can adjust it because on our unit it'll show you both actual and set point on your humidity. So you can adjust it to your relative humidity in the unit. But with that being said, I want to show you where the on button is here on this unit. We're going back here, and you can see we have it all set up for transport. So down here you have the on off button here. This is where the temp probe plugs in, and this is your air filter. We just changed the air filter, so it's good for 90 days, but that's where it would go. So as you can see, we have dual tank holders back here, your ventilator. This is a light that you can use. I don't have it plugged in right now, but if you need to use a light with the unit, as well as a blender and everything else that you would need for transport. Because as we come around the front here, and the very bottom of our unit, down here, this is our lithium ion power pack. It is going to run this unit for 2 hours when we unplug. How we access the battery is we just unplug it, and it switches automatically to battery power, and it gives us a 2-hour runtime. Actually, a little over 2 hours. When you have 15 minutes of battery life left, it will let you know by giving you a tone that says you do have 15 minutes to get to where you're going and plug it back in. So it allows us to do the one bed, one baby approach, where we take an extremely low birth weight baby, put them in here, avoid touching them, close it up, bring them back up to the NICU and care for them in the unit. So this is our controller, and I call it a touchscreen, or an intentional touchscreen. So if I try and touch it like I would my cell phone, you're not going to activate anything. But if you touch with more intention anywhere in this upper half, and by more intention, I don't mean pressure, it's more about time. So instead of a quick tap, you're going to do a more extended tap. So that'll bring up your 2 modes of warming. The orange baby icon here is your servo mode. The purple icon here represents the air circulating through the unit. That's your air control. So you choose your set point and use these change keys, which are the only change keys that are active on the unit. You may see these, but it's not active change keys. It's just showing you where to touch to make changes. So the active change keys, you can put your set point in and push close, or in 8 seconds it'll close itself behind me and make my changes. So when I'm looking at the screen, the mode and set point is here, the actual air temperature is here, and your baby's temperature would be here in orange. Everything baby associated will be orange. And the temp probe's just laying in there, so it just reads low. But we do want skin temp for your servo mode, which is abdomen. If they're supine, if they're prone, we'd use their flanks with your heat reflective temp probe cover over that. The little icon here just shows how much heat's being utilized by the unit to either increase or decrease your set point. You will see a little footprint here that says off. That is for a secondary temperature probe that would go on a peripheral extremity. I don't think you'll ever use unless you did a study, and it would be a white temperature probe that plugs in adjacent to the one I showed you previously, which is our main one. The number 45 here in blue, this is actually showing our relative humidity that is inside the unit right now. Even though I don't have humidity turned on, because it is such an integral part of our microenvironment, we're going to show you what it is. If I did want to use humidity, give it a good touch. It'll say, would you like to turn it on or off? We'll say on, and again, same change keys. Anytime you have an alarm, you have a visual, a soft, audible as well in the message center here. It'll tell you exactly why you're getting a notification or an alarm. So the large number is your set point on our humidity, and the small number is your set point. The large number is your relative actual humidity. And to turn it off, you just touch it again, and we'll turn it off. Our humidity chamber is located up here in the front. we open the door and give it an extra push down. That will disengage the humidifier itself. This is the tank that holds about 500 cc's plus a little bit of sterile distilled water. We gave it a nice big mouth on the container so it's easy to pour into, but mainly to clean. And this is the whole humidifier. There is no hidden tubings or baffles or cleaning systems that's required. This is an easily wipe down situation. And this chimney will reciprocate to a chimney that's at the bottom of the unit. And it's just that easy. And there is a white paper study where we purposefully contaminated the tank with Pseudomonas as well as staph, and we'd run it through the unit several times over and over, and nothing would culture out. So as far as an infection control standard, this is quite superior than what you're used to. We don't have any of those tubings or baffles that cannot be removed or cleaned. Everything can be physically inspected and cleaned, and we can clean this again with a baby in the unit in 3 to 5 minutes. And it just loads back in here and the door shuts. When I'm looking at the bottom menu bar here, the second item on the menu bar is our trend screen. And you'll notice also any information in regards to the patient will still appear on the screen to the right. But if I'm looking at the trend screen, you'll see the humidity is in blue, the baby's temperature in orange, and the heater in purple. And then you would see how the heater responded or when it was opened or closed. And if we were using pulse oximetry, it would report here on graph on the bottom. But anytime you're on an alternate screen, push the little home button, it'll bring you back to that main screen. This one also has built-in pulse oximetry. Let me bring it up a little bit. I'm going to use my reusable pulse oximetry, but I did put Massimo pulse ox probes in the drawer for you to use for transport, because unfortunately this, I know you're a Nalcor house, but our demo model only comes with the Massimo technology. But if this was yours and you ordered it, we would put certainly Nalcor in here for you. But all you have to do is connect the sensor to the pulse ox cord, and it'll automatically turn on the feature of the pulse oximeter. So you'll see the oxygen saturation pop up here, and then the heart rate on the side to the right here. The numbers to the side are your high and low alarm limits. And if I did want to change the alarm limit, just touch what you want to change, heart rate, lower, and adjust your set point accordingly. When I'm looking at the menu bar, the third item is a drop-down menu. If I access that drop-down menu, the first 2 items are deleting patients' previous patients' data, like trend and weight data. But the third item is pulse oximeter. If I select pulse oximeter, we can go to synchronizing beat, turn it on, turn it up, or back off. We can change the sensitivity mode. APOD stands for Advanced Probe Off Detection. I think that's more for ward use for extremely low birth weight babies. That would not be used very frequently. But you would normally pick either normal, or if you have a poorly perfused baby and having trouble getting a pulse ox reading, choose max. Also, when I'm looking at the menu bar, there's a little heart at the bottom. It's a little gold button with a heart. If I select that, it brings the module of pulse oximetry out to the forefront, so I can see my values larger as well as my pleth waveform. And this is what I like to use when I transport. So with our monitor, we can move it all the way around to the back, and I am only 5 feet tall, so I can bring it to its lowest point. And I can push this very readily, get behind it and push it all by myself wherever I need to go and be able to see over everything. And I can also see what's going on with my patient as far as the monitor here goes. Turn it back around. Now we can put this on the other side very easily by unscrewing it and changing the F-reel to the other side, along with all the other equipment on here. It's very easy to change around. And it does tilt as well. If I'm done with the pulse oximeter and I want to put the patient back on my monitor on this in the ward, just disconnect the sensor from the cord. It'll alarm, push alarm silence, it'll turn that module back off. And again, I'll bring it back to the home screen. Let's revisit that drop-down menu again just for the final few things. Service screen is for biomed. So if you're trending and you'd like to change your trending period of time, you can. There's a Fahrenheit to Celsius button that's very easy to change back and forth. You can change things like the brightness of the screen, There are 2 timers. When this is opened up into warmer mode, you have an APGAR timer as well as a CPR timer, or by pushing off, it'll go off the screen altogether. But I like APGAR timer on here for all times, because APGAR timer does a full 60-minute count, gives you alerts at 1, 5, and 10. But I like it in NICU because you can use it for any time you need a timer that's at finger's touch, such as your golden hour or timing a feed or whatnot. I like it. And the only difference between that and the CPR timer is that every 30 seconds, the CPR timer will give you a reminder to do your NRP heart rate assessment, as well as give you a 6-second visual count, so that you can count your heart rate, multiply it by 10, and call it out every 30 seconds. Alarm volume, very easy to change. High-low stand. If you have oscillators, chest tubes, everything connected to this, and because it does go extremely low, parents really like to bond with their baby, and you want to lock it from being moved, or you're doing a procedure on it and want it locked. Go to high-low stand, lock it out, and it renders the foot pedals inactive until we unlock it again. To unlock it, you revisit high-low stand, and now it says, would you like to release it? We'll acknowledge okay, and now our bed is free and the foot pedals are working again. And let's do this one has a built-in scale, so let's do a weight. I'm gonna weigh, this happens to be a oscillator porthole cover, so if you wanted to use it in lieu of one of our other porthole guards, you can swap it out, and that way you can have the porthole with the phalanges on it. So again, we're looking at the bottom menu bar. The 4th item and final item is the green button, which has a baby in the scale. It'll bring up our module. We'll push the weigh button. It'll say to lift the baby from the mattress. As it senses that change in pressure on the mattress surface, it will begin to zero the bed. It tells me to replace the baby on the mattress, and it will obtain our weight for us. There is a re-weigh button here once it is zeroed, and I haven't changed anything on the mattress surface. You can hit the re-weigh button as many times as you would like, just to ensure that you're getting consistent weights and that's accurate. The bed does say it stays zeroed for 3 minutes, so you have 3 minutes to use that re-weigh button. Each time I push re-weigh in that 3-minute period of time, by the way, it'll afford me 3 more minutes of the scale being zeroed. The gram to pound button will convert to pounds and ounces for you. If I push memory, it'll incorporate it into the graph. If I touch the graph, you'll see that it'll hold 30 weights, and it's first in, first out. And then we'll go home. We were talking about our air curtain being on all the time. That's one of the very prominent neurodevelopmental features in this, because it cuts down on noise, again, under 40 decibels of sound. Even our porthole doors, when they open and close, are virtually silent. I can access my access panel one-handed. So if I notice, there is actually a secondary lock that's automatic. So if someone puts the baby away and doesn't latch the latches, we're about at 0% risk of this baby falling out. All you have to do is depress that and let it go down. So that's going to come down nice and soft, which decreases that noise, which will startle the baby, which will increase their intracranial as well as intrathoracic pressure. The double door is easy to separate and clean, and it holds heat nice. The bed does come out each side. If you need to get in here quickly, you can do so very easily, and I will show you as a reference. So if we need to get in here quick, we can take this out, and we're already getting that hood raised and ready to access the baby's airway for repositioning or assistance. And these just snap back in. And you can leave them out if you like. They're just to keep babies from, as we know, they all creep down, just to keep them off the ends for us. Also, when the doors close, it creates a nice seal where there's nice and flat, the convex doors, so that little fingers and toes can't get in there. If I wanted to raise the hood, it's very easy. There is, on each side, there's an up canopy and a down canopy button. If I press and hold the up canopy button, it'll begin its progress to raise the hood. If it should encounter an obstacle, it will stop on its own. Or if I need to stop it on its rise, you can push the down button or step on a foot pedal, and it'll stop that hood from raising in case you have something taped to it. Now, there is a reason that this canopy raises slower. even though we can get in there in half a second to 1 second if we need to get to that baby quickly. But it's because it's a mathematically thought out intentional rise, because our goal is to keep the heat and humidity that's around our baby right now in with the baby and not with the hood rise wafted all out like some of the units you're currently using do. It's going to keep that heat and moisture with your baby as this heater starts to transition into the open warmer mode. And the same thing happens when we close it. It's a slow progressive descent. And you do have external tilt, by the way, that is very easy and smooth. And you also have external X-ray, so you don't have to access the microenvironment. So now we are on the screen for the warmer mode. So same thing, mode and set point in here in the center. This little icon is showing how much heat is being utilized, and our baby's temperature again would appear here. Same off button with the footprint, that's our secondary temperature probe. We can still see our pulse oximeter, and now we have our timer, and right now it's on CPR. So when it gets to 27 seconds, you're gonna hear a tone. To me, it sounds like the Olympic swim start, and it's saying, get ready, we're gonna count heart rate here, and then it will give us a 6-second visual count, and it will do it again a second time in case we weren't ready. So in just a few seconds here, you'll hear that tone begin, and it's gonna begin right now. 1, 2, 3, 4, 5, 6 times 10 is our heart rate. And again, it's going to do it a second time. You can also, actually, you can go back and forth if we didn't need the CPR timer anymore, but we want to keep accurate account of our APGAR time. Without stopping that, access the drop-down menu, go to the next page and find timer again, change it to APGAR, close this, now it's on APGAR. I'm going to go to the main screen. And that's the 1 minute APGAR, by the way. And to turn it off, just touch it. It'll ask, would you like to stop and reset it? Yes, so it does that. This is our tube holder, so it's very easy to use. It will hold your tubes in the inside, or if you need to hold it on the outside as well. So it is your tube holder. It'll also do gravity feeds. It'll hold a 60cc syringe on one side and a 5cc on the other. And also your tube holder, it'll also hold a lateral x-ray if you needed it to, so you don't have to be irradiated as well. So let me put that back. And you can, it screws in from the bottom, and you can just move it to any of the little side ports. Right here is a bubble level for your mattress surface level. It's a target level, but I always look at the sight lines here to see if it's completely perpendicular. That's how I like to do it, so I can adjust my level here to make sure it's flat. And now we'll have the descent here. Press and hold, and it will again transform back into the warmer mode, or the incubator mode. Another safety feature on this, if you notice, our porthole doors are about 2 inches above your mattress surface. Unfortunately, every year, approximately 15 baby falls are noted that are reported out of incubators. I'm not sure how many are not, but our mattress surface is down here, which is well below our portholes. So very, very unlikely that this baby would fall out through a porthole, as many are reported to do so each year. And it goes extremely low, but very high. And you'll find also that because of the portholes, how they design them, and they did a lot of research on what the best position for most people are, you will have a better sense of dexterity in here because you're not reaching down and up over the mattress surface. So you can care for the baby very easily. And it's very easy to roll. All 4 wheels are double cast, so you actually have 8 wheels on the ground that are easy to roll. It can roll backwards, forwards, side to side. And if you have any questions while you're caring for a baby in this unit, please reach out to me if I can help in any way. We also have quick guides that I printed out, so if you need basic functions, those are in there, but I will be glad to answer the phone day or night and answer any questions if you have them. I hope this helps you, and I look forward to seeing you guys soon. Thank you.